COVID cases are on the rise again in Colorado, and you've likely noticed it yourself. Maybe more people around you have gotten sick with COVID for the first time or even the second time since the pandemic began. Medical editor Dr. Dave Hnida is here to talk more about this increase in cases. And Dr. Dave, a lot of people are getting COVID again after already battling the virus earlier in the pandemic. Is reinfection a reality we should all just expect moving forward?
Yeah, I think the biggest question actually we're having in the medical community, is it fair to call these reinfections or new infections? Are we looking at a situation now as we go forward where people who wind up developing COVID are actually getting a new infection rather than being reinfected with the same germ? Remember, it is a illness that has an awful lot of mutation and variance to it. Coronavirus, if you recall, is a member of the common cold family. There are a lot of viruses that cause common colds, and we get common colds how many times per year, potentially, depending on your immune system. We think the same phenomenon may wind up happening with coronavirus. We may actually be looking at a situation where we wind up having the potential to be infected with a new COVID germ 1, 2, 3, 4 times a year. And that's the biggest fear we have. And the fear is there because this is not the common cold. This is an illness that is extremely contagious. It is something that can make you extremely sick. And so we really are wondering how we are going to handle this going forward. Obviously, boosters are very important at this stage of this pandemic. We're still in the pandemic, despite the fact that people have declared it officially over. It is not. We still have people who are going to continue to wind up becoming ill. What's the future, I think, is the biggest question we have. We do think people will continue to fight COVID infections, but we're hoping that perhaps over the course of time, each illness, each wave of illness will be a little less severe than the one before. And the risk of hospitalization, the risk of death will wind up becoming less and less. Now, having said that, that doesn't mean that's going to happen next week. I think we're talking the years or even perhaps decades to come. Hopefully, COVID is something that's going to burn itself out and become something more like the common cold, but it's not going to happen anytime soon. So please get your immunizations.
And you mentioned the importance of the booster in that. We've asked you about the second booster shot before. The CDC still only recommends the dose for those 50 and the immunocompromised. Do you think the eligibility should be expanded?
Sure do, and most of my colleagues think so as well. When you take a look at what goes on, sure, it's for people over age 50, it's people with immunocompromised immune systems. And so we really are seeing, though, that a lot of people who are getting either hospitalized or severely ill are people under the age of 50, people who have other disease processes going on in their bodies. We call them comorbidities. Basically, if you're under the age of 50 and you have high blood pressure, you have diabetes, you're obese, you have some other risk factor or health issue in your life, I think that getting the boosters are more important than you possibly could realize. It will lower your risk of staying out of the hospital. It will lower your risk of getting so sick that there is the potential for death. And so I think that in this circumstance, the boosters are important. And I do think that the age should be lowered below age 50 to perhaps even as low as age 12.
Great. And hospitalizations going up among the vaccinated. Are you worried that that's something that may discourage people from getting the vaccine or even their booster dose?
Well, I think that's the headline we're hearing. More and more vaccinated people are winding up in the hospital. But really, when you take a look at the numbers, we are seeing folks truly, who are fully vaccinated, who are winding up in the hospital, and people who are dying from COVID still, even though the rates are lower. Those folks, though, tend to be over the age of 75, or they are folks who tend to have underlying severe medical illnesses. And so they are at higher risk despite being immunized. When you look at the vast majority of people who are fully immunized, and they do wind up getting infected with COVID, despite being immunized, their diseases are less severe and they are not being hospitalized. That's really kind of a key point here. The other key point is the unvaccinated. The unvaccinated have a 700 times the chance of being in the hospital and of dying of COVID. So it's not just talking about boosters and whether or not you should hesitate getting a booster because it's going to help you. You still need to think about getting that first shot because you are at high risk.
And long COVID, also a concern among people who have gotten the disease. What do you know about children in long COVID?
Boy, I think the real question is, what don't we know about long COVID in children? It's really a complex issue. We're having a hard time understanding it in adults. When you take a look at kids, we do know that children can get COVID. They do tend to get COVID in a less severe form, even though occasionally they can get hospitalized. But we also do know that COVID is something, long COVID is something that tends to be something that mainly takes place in people who don't have severe disease, and we're starting to hear more and more about it in children. And what we think is happening, whether it be adults or children, is that even mild infection winds up affecting a multitude of areas in the body, whether it be the brain, the lungs, the nervous system, and so forth. And the reason for that is the immune system does go into hyperdrive. The immune system winds up attacking itself. There's a lack of oxygen to certain tissues in the body, and it winds up causing longer-term symptoms that just simply do not want to go away. They wind up recurring, and those include things like problems with learning, problems with thinking, problems with shortness of breath, fatigue, cough, stomach issues. And so even though there's not a lot we really don't know about it at this point in time, the good news is that there is an awful lot of recognition that this is something that is with us at this point in time and will be with us in the years to come. There are numerous research centers that are increasing the amount of work they're doing, including here in Colorado. National Jewish has a great long COVID center. And I think as we see more and more centers really stepping up, we're going to be able to work a little bit more harder on being able to help people who do have long COVID. And once again, this is a very underestimated, underreported part of COVID is people think, well, it is just a cold, or if I get it, I'm going to be fine. It is the long-term effects that we really have not even seen the devastation that it can wind up causing to this point yet.
Yeah, which is something that's just been interesting through this all. Thanks so much, Dr. Dave, for taking the time to talk to us. I know there's been a lot of new questions, so we appreciate it.
You bet.
And you can watch all of our Q&A with Dr. Dave segments on cbsdenver.com.